Welcome to Students Friendly, all about study. Now we are going to discuss about community health nursing. In community health nursing, first we are going to discuss about concepts of health. First we are going to deal with the concepts of health. Health is evolved over the centuries as the concept from individual concerns to the worldwide social goal and hence emphasis the whole quality of life. Health is evolved over the centuries as a concept from individual concerns to worldwide social goal and encompasses the whole quality of life. An understanding of health is the basis of all the health care. An understanding of health is the basis of all the health care. Health is not perceived the same way by all the members of the community, including various professional groups, giving rise to confusions about the concepts of health. An understanding of the health is the basis of all healthcare. Health is not perceived the same way by all the members of the community, including various. ആയിട്ട് ചെയ്യൂല ആ സാറിലെ Now we are going to deal with the community health nursing. In community health nursing, now we are going to discuss about the concepts of health. Now we are going to discuss about the community health nursing in that concepts of health. Already before that we already discussed about this community health and nursing and community, what is the meaning of the community health nursing also. Now we are moving to concepts of health. Concepts of health. Health is evolved over the centuries as a concept from individual concerns to worldwide social goal and encompasses the whole quality of life. Health is evolved over the centuries as a concept from individual concerns to worldwide social goal and encompasses the whole quality of life. An understanding of health is the basis of all the health care. An understanding of health is the basis of all health care. Health is not perceived the same way by all the persons of the community, including various professional groups, giving rise to confusions about the concepts of health. That's where showing as to the concepts of health is different in the different way. The various changing concepts are, we are going to list out. First one is the biomedical concept. First concept in the various concepts, first concept is biomedical concepts. Second one is a ecological concept. Third one, psychosocial concepts. Fourth one, holistic concept. The concepts of health, we are going to discuss about this, the biomedical concepts, ecological concept, psychosocial concept and holistic concepts. These are the various changing concepts of the health. Then biomedical concept. First we are going to discuss about the biomedical concepts. The biomedical concepts is traditionally health has been considered as an absence of disease, and if someone was free from disease, that person was considered healthy. Traditionally, in biomedical concept, traditionally health has been considered as an absence of disease. In here we consider as to the absence of disease. Absence of disease. Traditionally health has been considered as an absence of disease, and if someone was free from disease, that person was considered as a healthy person. This concept is known as biomedical concept. This is based on the germ theory of disease. This concept has known as biomedical concepts, and this is based on the germs theory of disease. Health means absence of disease. The medical profession viewed the human body as a machine, and as a disease is an outcome of the breakdown of the machine. And one of the doctors was a repair of the machine. Like that only we consider the human body. Here we are first discuss the biomedical concepts. In the biomedical concepts, what we are saying means is health means that's absence of disease is a health, and it is based on the germs theory. Then second one we are going to ecological concepts. This is the second one, ecological concepts. First one biomedical concepts, then second one is the ecological concepts. Deficiencies is the biomedical concepts give rise to another concept or the other concept. The ecologist put forward the concepts of ecological concepts of ecological concepts. Ecological viewed health as a dynamic equilibrium between man and his environment, and disease as the maladjustment of human organism to environment. That is said by this the ecologists. Then here we are going to discuss detailedly the ecological concepts. Ecological concepts saying deficiencies is the biomedical concept. The deficiencies only mentioning the biomedical concepts. The biomedical concepts what we are saying absence of disease only biomedical concepts. Here the ecologist is saying in the ecologist viewed health as a dynamic equilibrium between man and his environment. Ecologist viewed health as a dynamic equilibrium between man and his environment, and the disease as the maladjustment of human organism to environment. It is an adjustment between man and environment. That is said by the ecologist. Concepts of health, we have mainly the four concepts are there: biomedical concepts, ecological concepts, psychosocial concepts, and holistic concepts. Here first we discussed biomedical concepts. Here we are saying it's an absence of disease. Then second one is the ecological concepts. In ecological concepts, it is an equilibrium between the man and environment. Then next we will move to psychosocial concepts. That's the third one, psychosocial concepts. Okay. In here we are discussing advances in social sciences show that health is not only biomedical phenomenon but one which is influenced by social, psychological and natural, economic and political factors of the people concerned. Here the psychological or the psychosocial concepts. The psychosocial concepts, what they say means advances in social sciences show that health is not a biomedical phenomenon. Here the first one we have said that it's related to the biomedical only. No. Then the ecologists say that is not related, only related to the biomedical. It's related to the man and environment, some adjustment only. Then the psychologists are saying like that It is not only the biomedical phenomenon but one which is influenced by social, psychological and cultural, economic and political factors of the people concerned. Here they say about the which are all things, means it is relating to the social, political, cultural and economic. Psychosocial means it is not only the biomedical concepts related, it is the basis of this the psychological, cultural, economic and political factors of the people concerned. These factors must be taken into the consideration in defining and measuring health. This is the psychological concepts they are mentioning. These factors must be taken into consideration in defining and measuring health. Health is a biological and social phenomenon. Okay, and the advance in social sciences shows that health is not only in the biomedical. In the first concepts we mentioned, it's an absence of disease only. It's only related to the biomedical. Then second concept they are saying that not only the biomedical, it's having some relation between man and environment. But in the third concepts, once we are reaching to the third concept saying this is not only the biomedical, it's having some other factors also. The factors are psychosocial, political, cultural and economic. That is the mentioning in the psychosocial concepts. We discussed three concepts: biomedical concepts, ecological concepts, psychosocial concepts, and now we are moved to the holistic concepts. That is the last concepts, holistic concepts. The holistic model is a synthesis of all the above concepts. They are saying it's a synthesis of all the above concepts. All the above concepts means is the first one, second one, third one. These three are mentioning in the holistic. The holistic model is a synthesis of all the above concepts. Holistic concepts recognize the strength of the social, economic, political and environmental influences of health. In here the last concept, holistic concept, the holistic concept recognizes the strength of the social, economic, political and environmental influences of health are there. It has been variously described as multidimensional process involving the well-being of the persons as the whole. The emphasis is on the prevention and protection of health. The emphasis on the promotion and protection of health. The holistic approach implies that all sectors of the society have an effect of an health, in particular agricultural, animal husbandry, food industry, education, housing, public works and other sectors. All the sectors this is involved. The holistic approach implies that all the sectors of the society have an effect on health. So all the sectors of the society have an effect is there. The effects are particularly the agricultural, animal husbandry, food industry, education, housing, public works and other sectors. These are the included materials or factors in the holistic concepts. Here the concepts are mainly four concepts. The four concepts are: first one biomedical concept, second one ecological concepts, third one psychosocial concepts and the last one is the holistic concepts. These are the concepts of health. Next we are moving to determinants of health. Determinants of health. Determinants are predispository factors which influences the health of a particular community. Determinants are predisposing factors which influences the health of a particular community. Some common determinants are there. We can see which are all the common determinants. First one, biological. Second one, environmental. Third one, behavioral and socio-cultural. Next one, socio-economic. Next, health services. Determinants of health, biological determinants, environmental, behavioral and socio-cultural, socio-economic and health services. These are the some main determinants of health. Then other related determinants are food and agricultural, education, science and technology, standard of living and social justice, equality, human rights and government policies, how to make the standard of living and intersectoral contribution. These are the determinants of health. Determinants of health means it's a predisposing factors which influence the health of a particular community. Common determinants are, first one is the biological, second one environmental determinants, third one behavioral and socio-cultural and socio-economic, health services. These are the main determinants. The sub-determinants or some less important determinants are food and agricultural, education, science and technology, standard of living, social justice, equality, human rights, government policies to how to raise the standard of living and intersectoral contribution. These are the determinants of health. Now we discussed about the two topics. First one is the concepts of health and second one is the determinants of health.